Hi, my name is Nurliana binti Asman.
Hi, my name is Nur Edina Nadia binti Abdul Rashid.
Hi, my name is Hanin Fadlina binti Omar.
Hi, my name is Nurhanani binti Saali.
Hello, my name is Nur Husna Izzati binti Muhammad Soizat.
In this video, our group will be presenting about Marfan Syndrome. Make sure to focus and enjoy!
Marfan Syndrome is an autosomal dominant inherited connective tissue, which means a child can inherit this condition if they receive one copy of mutated gene from a Marfan Syndrome parent. It can affect different parts of your body, like heart, blood vessel, eyes, and skeletal structure, which can lead to various complications. Marfan syndrome is commonly described based on severity of symptoms and the systems affected. It can range from mild to more severe forms. This rare genetic disorder was first identified by a French pediatrician called Antoine Berlet-Jean Marfan. Back in 1896, Dr. Marfan came across this condition when he examined a 5-year-old girl with disproportionately long limbs, thin fingers, and some cardiac anomalies. This was later to be known as Marfan syndrome. Now let's move on to the next part.
Next, moving on to the symptoms of Marfan syndrome. These symptoms vary in severity since connective tissue can be found throughout the body is affected. The signs can range from mild to serious. Individual might notice chest abnormalities. As you can see in the picture, the breastbone will be either protrude or appear sunken into the chest. Next, longer arm, legs, fingers and toes, and longer and narrower face as depicted in our poster. Other symptoms include curved spine, joint pain, lazy eyes, headache, and difficulty breathing. Moreover, Marfan syndrome can affect various areas of the body, which can lead to an additional complication. For instance, dural ectasia and enlargement of the main artery, which is aorta. This enlargement weakens aortic wall and causing it to bulge, which can potentially lead to a life-threatening condition if aorta ruptures. Not only that, cloudy areas in the lens of the eyes, known as cataract, might develop. Other than that, retinal detachment. Weakened connective tissue makes retina prone to detachment due to structural abnormalities of the eye shape and size. Therefore, if you recognize any of these symptoms, seeking further medical evaluation is crucial.
Now, we move on to the diagnosis of Marfan syndrome. Unfortunately, Marfan syndrome may be challenging for doctors to diagnose because many connective tissue disorders have similar symptoms and it varies widely even among family members. Hence, to diagnose a patient with Marfan syndrome, the doctors will first ask about your family and medical history. This is because family history gives important clues as the disease runs in the family, whereas medical history allows the clinicians to learn about your current symptom and your past medical problems. For example, Marfan syndrome can be diagnosed in a person with displaced eye lens or previous surgery on aorta. The second diagnosis that can be done is through eye test. It can be divided into two, which is slit lamp exam and eye pressure test. Slit lamp exam, a person's eyes will need to be completely dilated with drops to check for lens dislocation, cataracts, or detached retina. Whereas for the eye pressure test, the test is done to check your glaucoma, which your doctor measures the pressure inside your eyeball. Next is echocardiogram. It uses sound waves to capture real-time image of your heart motion. It will also check the condition of your heart valve and the size of your aorta. Physical examination also can be done to diagnose Marfan syndrome. For example, they will ask you to fold your thumb inside your fist, and if the thumb extends beyond the palm of the hand, Marfan syndrome is a strong possibility. Last but not least, Marfan syndrome can be diagnosed by genetic testing. In most cases, genetic testing is helpful to screen the genes that cause Marfan syndrome and related conditions.
Next, what causes this syndrome? Marfan syndrome is a point mutation in fibrillin gene. Point mutation occur when the gene is added, deleted, or changed. Most cases are because of mutation in fibrillin 1 gene or called FBN1 gene, while another 25% are due to unknown cause. Generally, there is a defect in FBN1 gene that disturbs the production of fibrillin. Fibrillin is a major component of connective tissue. Furthermore, this syndrome is autosomal dominant, which can occur in either in men or women. It is also called heterozygous mutation because the person will inherit one normal FBN1 gene and one abnormal FBN1 gene. Now, let's move on to the mechanism. Normally, at chromosome 15, the chromosome that carry normal FBN1 gene will encode a normally functioning fibrillin. Fibrillin will act as a sequester for transforming growing beta, or called TGF-beta, which controls the body growth. Fibrillin also a major component of connective tissue that plays a huge role in elastic fiber formation on the tissue. Therefore, Marfan syndrome started when there is heterozygous chromosome at chromosome 15 which carry the normal and the abnormal gene. Then, it will produce dysfunction and less abundance of fibrillin. Upon this, the TGF-beta will not be sequestered efficiently. This will lead to excessive signal on body growth. More growth rate will happen to the bones and causes longer body parts such as long arms, fingers, and legs. Moreover, less fibrillin also means less elasticity in tissue that will causes the weak joints and retinal detachment.
For Marfan syndrome, there is no cure, but with proper and proactive treatment, many patients with Marfan syndrome can manage symptoms and live active lives. Firstly, for vision issues, cataracts and lens dislocation are common. Management involves replacement of natural lens with artificial lenses through surgery. Next, move on to the heart complications. Issues like aortic enlargement can be managed with the medications like beta blockers to control heart rate and blood pressure. Angiotensin receptor blockers also help dilate blood vessels. Surgery may be required to repair or replace the aorta. Next, for the musculoskeletal problem, physical therapists can help build muscle strength and endurance through exercise like swimming or cycling. Other than that, braces can support joints like the spine. So, the combination of occupational therapy, appropriate low-impact exercise, and spinal bracing provides crucial musculoskeletal management. This helps those with Marfan syndrome maintain strength, flexibility, and improve function for daily activity. A multidisciplinary approach is key for the best quality of life.